I want to say good morning and welcome to Planning for the Whole Community. This is an FNSS awareness seminar, and it is sponsored by the Houston UASI, which is the Urban Area Security Initiative, and the Houston Regional Catastrophic Preparedness Initiative, and the City of Houston Office of Emergency Management. For those of you who don't know me in the room, which most people do, but those who don't, my name is Sharon Knowles again, and I'm the Deputy Emergency Management Coordinator for the City of Houston. By show of hands, how many people in the room know what FNSS stands for? It is Functional Needs Support Services, and they are defined as services that enable children and adults with or without disabilities who have access and functional needs to maintain their health, safety, and independence in general population shelters. Individuals who can require FNSS may have sensory issues, they may have a physical or a mental health or a dependency type concern, and these are all things that we need to be able to look at when we're doing general population shelters and to be able to meet the needs of all of our community, not just parts of our community. So let me ask a question. Who else benefits from FNSS?
The whole population.
The whole population, especially people who are seniors, individuals who have a hearing impairment, individuals who are in their final trimester of pregnancy. Okay, it can also be someone who has bariatric concern, right? Okay, who else? You said the whole community. Who has gone shopping, grocery shopping, shopping anywhere, with a cart, and when you came out of the store, pushed your cart through a curb cut to get to your car? Come on, show your hands. I did. Who else? Everybody does it because we don't want to take our cart and drive it off the curb, right? So we take what we think is an easy thing, it's a helpful thing, and we benefit from an FNSS service because of that curb cut, right? So when we talk about it, we need to talk about it from the sense everyone does in fact benefit. And thank you, Terry, for that. Based on the last census, there are 54 million Americans, that's approximately 1/5 of the US population, who have disabilities. 3 million Texans have a disability. 1/4 of Texans with disabilities live in our region. 1/4. So you can do the math based upon the numbers that I gave you, right? So is this an important issue? It's a very important issue. And why has it become important? Not because there's been a change in the population. It's become an important issue because historic practices in doing general population shelters have resulted in differences of service delivery. Not everyone had their needs met. Not everyone was provided with equality. There are no waivers in laws that say that just because this disaster happened, we can now discriminate against a particular group in our community. It doesn't exist. Make sense? But more importantly, what's the moral thing? We are supposed to take care of one another and help each other, and when disasters happen, we tend to do that fairly well, except for folks who have a functional or access need or a disability. And that means times need to change. So federal and state level agencies have begun pushing out guidelines to local jurisdictions to say, it's time to make a change. Time to wake up. Time to make a change. So, with that, that prompted the State of Texas Division of Emergency Management to create a committee in 2010 that would address not only what the guidance was that came from the federal level, but how does that guidance fit within the state of Texas. We are one of 3 states who have a state law that has standards that are greater than the federal law. And consequently, it became extremely important from a state standpoint that we took the guidance that came from the federal government and be able to share that with local jurisdictions so that they understood what the state of Texas requires, above and beyond what the federal government might require. Make sense? So in April of 2011, they rolled this toolkit out, this FNSS toolkit out. The committee was comprised of emergency managers from across the state, representatives from several state agencies, and people with disabilities at the table. Today, we are already in the 4th version of that document. It's already been revised 4 times. Later this month, the committee will meet to review it for a 5th time, and I already know that there will be revisions made, because there are some best practices that exist within the state of Texas that we can share with other jurisdictions who are not quite sure how to begin this process. Additionally, the state of Texas formed a committee to look at the Transportation Assistance Registry, which by state law was supposed to be a statewide program, but turned out to be predominantly for the coastal region. And the goal of that was to identify where enhancements need to be made, how can that registry be of greater help in planning, not just for evacuations, but also for shelters and other types of things in the community that might occur. How can it help bridge some of the preparedness efforts that need to take place? Consequently, in March of this year, a new program was rolled out called STEER, State of Texas Emergency Assistance Registry. It collects more information than before, but it helps jurisdictions to be able to determine what the needs are within its whole community based upon the registrations that are made, and therefore be able to use that information to better plan for how to meet the needs of residents within shelter environments, an evacuation hub, or an immediate evacuation potentially out of a home, or to help educate first responders in how to communicate with individuals in an effective manner. That means all individuals in the community. Make sense? Okay, so Houston is one of those areas that has been ahead in some of this. And so therefore we've been at the table on both of these committees pushing this whole effort of whole community and helping to encourage other jurisdictions across the state of Texas to become engaged. About 18 months ago, we did the first FNSS seminar. It was held at MHMRA's facilities down in Southwest Houston. But today is a follow-up to that as well. And your being here means that, one, I get to say thank you for the good weather today, because we all traveled in much better conditions than they did 18 months ago. And 2, thank you for your personal interest in being here, because your presence means that there is a desire on your part to see a change in the historical practices that have occurred in the past. It means that you have an interest in working together in your communities to improve what happens for our whole community. You have a commitment to that. Now, I can say that, and it's an assumption on my part. I can only say that with true validity in regards to myself. So the question then I pose to you is, as with all of our emergency management plans, you need to validate your assumptions. So, am I correct? You want to see things from the past changed? You want to work together? And you want to improve the planning for our whole community? Show of hands. I don't see any hand not raised. So with that, I say again to you, thank you for being here today. And we're going to turn our attention to getting started in that endeavor and have our first speaker come up.
My name is Stephen Meisner. I'm the Regional Disaster and Program Officer for the American Red Cross here in the Texas Gulf Coast. And so we'll be talking today a little bit about what the Red Cross's stance, and this is really our national perspective on the topic of working with people with disabilities and functional and access needs in our shelters. For those of you not as familiar with the terms, the functional and access needs are very specific terms that refers to actually a broader category. People with a functional need are people who have an inability to perform some particular function, and an access need is some inability to access services that we're trying to provide. So the terms were developed as a collaboration. The Red Cross was part of that, working with FEMA, with the Department of Justice and the interpretation of the ADA laws. And this is really how we look at things in terms of emergency management and how we're going to try to modify our services or our programs to provide access and to assist people with those functions as needed. So in general, what we'll talk about today is the Red Cross national commitments, things that we've discussed on a large scale level in every state. The Red Cross shelter operations, we'll just I'll give a general overview of what we do in our sheltering program. And then really we'll talk about some of the shelter considerations and the accommodations that we have been able to make in our sheltering program. And then really just looking at different organizations and partner agencies and how we work together in resolving challenges that do occur in disasters. So to begin with, we'll just talk briefly about our mission and our values and principles. So the American Red Cross prevents and alleviates human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. That is our overall mission, and that's consistent throughout the country. Everything we try to do is based on that. There's a lot of text on this screen, but this is our vision. Our vision is really just focused on turning compassion into action. Working with volunteers, working with our communities to help people be prepared, to help people feel like they have a role in a disaster, and to understand what that role is in providing services. In an emergency, we always try to make sure there are trained people nearby. People understand what their role is specifically going to be, because a disaster is never a time when you want to try to find out what you're going to do, either as an organization or as an individual, to help people and really to save lives if needed. Our principles, this is really related to our international presence. The Red Cross is part of an international federation of Red Cross and Red Crescent societies, and the principles are consistent through all those societies throughout the world. And as we interpret those principles, we really look to three of these when it comes to working with people with disabilities in a disaster. So first and foremost is humanity. We focus on human dignity, and it's the right thing to do to ensure that people have the ability to access our services. Impartiality. Okay, impartiality is really our focus on not discriminating based on race, on religion, on class or political opinions, but in this case, we don't want to discriminate at all for anyone. Everyone has equal access to our services, period. And then the third is really looking at neutrality. As everybody is aware, this is a very controversial issue, or really it's a very hot topic in the political world, and we don't take a stance on any of the laws or any of the positions. All we do is try to focus on making sure people have access to services and that people are able to receive those services in a disaster. That's all we try to fight for and advocate for. So based on our our principles, we really just focus on what is our need, or what is the ability for people to find access to those services. So I did have a quote actually in here from our Senior Director of Disaster Services, who basically describes the national interpretation of those principles. When it comes to sheltering, the sheltering program in the Red Cross is actually an umbrella term that describes a number of different types of operations. So the first type of the operation is really just a generic mass care site. Any location where people are leaving a dangerous area and going to a place of safety is a mass care site. So this could be, for example, a respite center or an evacuation point. A few weeks ago we had an exercise here in this building where we were talking about an evacuation from a flooded apartment complex, and people needed to leave and go to a place of safety, and that was referred to as an evacuation point. Well, those types of events are managed by our sheltering program because the services are very similar to what we see in shelters. So it's easy for us to educate our volunteers to say, you know what, it's not a shelter, but it's very close. We're just not setting up cots in this area. And so generally the services we provide are snacks, hydration, emotional support, overnight housing, overnight housing assessment. What that is basically when we go out and we'll interview clients to determine what is their overnight housing plan. Did they lose their home because of whatever the emergency is? Do we need to talk to them about a transitional plan, or do we need to start considering that we need to open a shelter? So we're not at a shelter yet, and those services are very basic. A respite site is something that we'll see in the middle of another operation that's going on concurrently. So it could be at a decontamination location where perhaps people from the public need a place to go to receive services, some emotional support. It could be also at a family assistance center, where basically the Red Cross is set up. Again, it's a shelter without cots. It's not our operation, but we have people there providing services. And then we'll also see sometimes respite and information centers. These are, again, non-shelters, but a lot of times we'll open up a facility to provide information to the public. They might not need housing support, but there's a disaster of such significance that people are going to come into the shelter anyway. And a lot of times we'll still provide feeding support because it's very easy for us to provide a meal, and then at night we'll have some sort of a public briefing as well, and that's a good way to get people together at the same time. Let's talk a little bit about our disaster services program as a whole. So the services that we provide in a disaster do include sheltering. They include feeding. Whenever we have a shelter open, we will provide food. We also provide food throughout the community in mobile vehicles. Provision of essential items. That's a very broad term. That basically is our bulk distribution program, where we'll drive different streets or different locations, and we'll provide cleanup kits, items for the community, and we keep that definition very vague because it's whatever people need. What are their needs? That's what we're trying to provide. Disaster health and mental health services are very significant. Every disaster, particularly mental health, there's going to be a huge need, and we'll always have a need to have additional trained health and mental health volunteers. In addition to those basic services, we also provide public information, and sometimes that's just information that's being fed to us from our local government or from our partner agencies, but we reissue that or repackage it and make sure that everybody's actually receiving those messages. A lot of times that's because we're in a shelter and we already know where people are, and that gives us an ability to share that information with them. Welfare information and family reunification. So a lot of people don't know that we do this, but whenever people have lost their family members in a disaster, we actually try to facilitate that reconnection. Part of the reason for that is because that's sometimes their only way out of the shelter, is reaching out to their family. So if they need a phone call or they can't find their family member, we'll reach out to partner chapters throughout the country in the Red Cross, and we'll try to find those family members. And we also, a part of that is also our Safe and Well program. The Safe and Well website, which is a generic website anybody can log into to say that they're safe and their family members will know where to reach them. Community assessment and planning, client casework and recovery planning. There's a lot of things that the Red Cross does. In preparedness, preparedness for shelter. And we know that every chapter throughout the country is probably going to have to open a shelter at some point because of a disaster. We never want to, but we do want to be prepared. So chapters are encouraged to work with the community to have an understanding of what is it that we need to do in order to open that shelter. And a lot of times that's based on our relationships. So part of the process that we do is we conduct a shelter survey. We have an agreement, and this is an independent agreement with our churches or with local community locations where a potential shelter could be open. The survey itself is it's about a 2-hour survey of the facility that tells us approximately what's the capacity and roughly how accessible is it. So there's information in that survey that's recently been modified to be consistent with the national ADA guidance to make sure that we are asking appropriate questions and consistent questions in terms of toilet heights and widths of doorways, because we want to make sure that if we're gathering information, we'll be able to share back with our partners to say, yes, this building is relatively accessible. We don't ask all the questions from the larger checklist, because I think there's over 200 some odd questions, but we ask enough to know whether or not it's going to be accessible or can it be modified in a disaster. So we use that information once we need to open a shelter to be able to say, okay, this is a facility that maybe we need to make sure that we have a ramp on standby, or this is probably not a facility we should be in the first place because we've already surveyed it and we know that it could be a challenge. Helps us to understand those types of things. So now let's talk about evacuation centers. So an evacuation center is a little bit more of a formal location that gets set up. Again, we're not quite at a full shelter yet, but this is usually, could be open for 24 to 48 hours, and this is oftentimes what you'll see in reaction to a potential storm. So an evacuation center we might need to open, and we're planning to shelter in place. We'll have emergency heater meals that are brought in. Services are still relatively minor. We often don't bring cots because we're expecting the people who got their own provisions, they're encouraged to bring their own camping equipment and things like that. The preference is really to have people evacuate when the local government is encouraging them to do so, and we don't want to contradict that. But at the same time, there are shelters that will pop up from our community partners, and we want to be in a position to at least have somebody there to understand, is this still safe? What's happening in this location? So a lot of times these will even be partner locations. Evacuation centers could be used for other types of events. There could be an active shooter where you've got an entire mall that needs to evacuate. Go to a place of safety for a period of time and they can't get to their vehicles. Well, until they're able to get out of that area, we could be looking at an evacuation center. Okay, so an emergency shelter. We call it an emergency shelter just really to distinguish it from some of the other types of operations. But an emergency shelter is anytime we know that somebody has got some sort of housing interruption. Their home is either inaccessible to them or it could be destroyed or damaged. So you'll start to see definitely an expansion of services in an emergency shelter where you'll have cots, blankets, comfort kits. We do have a full shelter staff, including a shelter manager, health and mental health workers, and a series of expanded services. Usually we'll also start our casework at this point to really have an understanding of, well, why are you in the shelter? What happened to your home? Why are, what is it that causes you to be here? So usually this type of operation will last up to weeks. As disasters start to move forward, then we start looking at temporary housing shelters. So oftentimes what you'll see is if there's a lot of shelters that are open in the community, we start to consolidate them down to one or a very few number of shelters that we start referring to as either the long-term shelters or the temporary housing shelters. We do this when there's no other temporary housing options available in the community and we know the people have got destroyed homes. So we're basically looking at going into this for the long haul. So there's going to be an additional expansion of services. You'll start seeing FEMA and other partner agencies really start to have a strong presence there because we want to make sure people are getting their mail, they're able to go back to work. We're trying to facilitate something with their children to make sure they can either get to school or we've got some sort of classes on site. It gets much more complicated when we start looking at these longer term shelters. And they can last for months. We don't always do this in every disaster, but sometimes when we need to consolidate and we've got everybody who's left from the disaster has no other options of where they're going, that's where they're going to end up. Okay? So shelter management variations can vary. The Red Cross does not always run every single shelter that opens. In fact, a lot of times we don't run many of them. So there's Red Cross managed shelters, which is where we've got a shelter manager on site. We have an entire shelter team. We're providing services, and we've usually got our operations center open, providing all the coordination for it. There are community organization managed shelters, which oftentimes will be managed by a local church or different groups. Government managed shelters, and then there's co-managed shelters where the Red Cross is seen as a co-lead role, and that's really something that we try to encourage as much as possible anytime we encounter a community organization shelter. They might not have had a relationship with us in advance, but during a disaster, we try to let them know, look, we are actually pretty good at this. Can we help out? So that gives us an ability to influence how those shelters are managed, and really start to advocate for our clients in the way that we're normally doing. So in addition to our sheltering services, within a shelter, these are the services that you'll see. There's information dissemination. We already talked a little bit about that. Dormitory management, that's what probably the most important part of the shelter is the dormitory, where it's where the people are generally staying or living. And having our volunteers go through the dormitory, provide the emotional support, the advocacy, understanding the client's needs, that really helps to expedite our casework. Feeding, we do provide full meal service in our shelters, registration so we know who's there, and then bulk distribution, casework, health and mental health services, and recreation and childcare. So these are the things that you'll see in just about every shelter when we're talking about the emergency shelter or the transitional housing shelter. Okay, so the FEMA Functional Needs Assistance Guidance is really where we base a lot of our modifications to our policies on, because it is a national program that we had looked at. So it was developed in consultation with the Red Cross and other key stakeholders, and we serve people with disabilities and other access and functional needs based on the international principles. So we already talked a little bit about that, about how our principles really reflect our stance on the matter. And we continue to expand on the national strategy. The National Mass Care Strategy, which was also recently co-developed with the Red Cross and FEMA, further expands on differences in policy or accommodations that can and really should be made in any disaster or in any shelter. Whether it's our shelter or not, it's something that we're advocating for should be in everybody's plan, okay? But there's no one-size-fits-all approach. The reality is when you're working with a client, there's going to be different solutions that need to be made in the field in order to make an accommodation, or in order to understand the needs that the client is going to have. And we want that client to be a part of that solution, part of understanding what is the need and what is the solution to that. So again, our managed shelters are available to anyone affected by a disaster. So if somebody is affected and we have a shelter open, we're not going to say no on whether or not they can come in. Everyone is welcome to come in. Shelters are either going to be general population shelters or some sort of government-run medical shelters. You no longer see the term special needs shelter from the past that we've had. That's not part of the National Mass Care Strategy. There are still some states that I think have that in their plans, but generally they know that that is not something that the Red Cross is in the plan of supporting. Our shelters are open to the general public unless there is a specific medical treatment related need. So that kind of gives us a very clear line to say if somebody has a medical need, then we can start looking at what's the right location for those resources. If not, then our shelter should be accessible. Okay? And really the goal is to remove the term special from our lexicon, because I think we've talked about that in this group before, is that it's not special. It's that people have needs and everybody has a right to access those needs. Okay? So we're often seen as the agency responsible for medical shelters. We are not. Sometimes we will provide assistance. Usually it's nothing more than coordination between the general shelters and the medical shelters to determine who needs to go to one location or the other. As people are discharged from the medical treatment, they need general sheltering. As people deteriorate in the general shelter, they need to be transported. So this could be at a hospital, or it could be just at a general shelter, at a medical site. Could be run by FEMA or the local government. Who knows? It's not our operation. We're just there to provide support. Okay. So some limitations on care. Again, the advanced care, the advanced medical needs, those are things where we start really looking at, when someone needs to be transported out of the shelter. That's now the only line that we draw as far as whether or not someone can be accommodated. With the exception of the medical needs, we will try to make every accommodation that we can in the general shelter to make sure people can stay. And our focus is really on independence, is making sure that people can be independent in the shelter, rather than relying on our staff, who are not as closely trained as some professionals in the community. So if we need somebody to come into the shelter who has advanced training, if there's a specific need for that, then we'll provide that, or we'll reach out to our local government to make sure we can bring in that resource, to make sure that people are going to be successful in their shelters. Okay. And really the focus is, what does this person need to be able to live with relative independence in our shelter? That's what our shelter staff are trained to do, and that's what all of our national sheltering training has recently been revised to encourage, that this is now our stance on it. And if there isn't a reasonable accommodation, it should be implemented. If we cannot make the accommodation with our internal resources or our existing partners, that's when we reach out to our local government to try to find that accommodation, okay? So the Americans with Disabilities Act does require the Red Cross to take steps to ensure no individual with a disability is excluded, denied services, segregated, or otherwise treated differently. Remove architectural and communication barriers in existing facilities where changes are readily achievable. So the facilities do not belong to the Red Cross. We're going to have a very limited ability to make any particular modification to the facility. However, we can advocate for it, we can encourage the building owners, or we can notify our local government if we anticipate that there is some sort of an architectural challenge. Make reasonable modifications in policies, which we have done on a national and a local level. And again, we don't own the facilities. Also, we can't compel other sheltering organizations to provide inclusive services. As much as we can advocate for providing inclusive services and in fact modify our training and provide it openly to our partner groups, there are still going to be shelters that may not be accessible, and those are not shelters that we directly have any control on. If we're not in either the co-managed role or the Red Cross managed role, we have no operational control of the shelter. So all we can do is advise and suggest and try to encourage our partners to say, look, you know what, maybe this is your first time running a shelter as a faith-based organization, but these are some suggestions that we would offer to make your facility a little bit more accessible. And most groups are pretty open and appreciative of that. So a reasonable accommodation is any change in the environment or in the way things are customarily done that enables an individual with a disability to enjoy equal opportunities, plain and simple. That's what we try to strive for. And so when we're making a reasonable accommodation, some of the things that we've done, like I said, with our shelter survey, we've modified the survey itself to make sure that we're looking for facilities that do meet the ADA standards. And we work with those facility owners to make temporary changes to increase accessibility when we're operating the shelter. So that might be as far as if we know the facility is going to be a challenge, we might find ramps that are either available locally or we look for accessible restrooms or shower units, and if we can't find one or put it on site, then we'll look out into the community and try to have some sort of a contract or agreement in place to make that happen. And if we can't find anything like that, then again, we'll reach out to our local government and see if they can find one. Okay. Service animals. Okay. So the ADA defines a service animal as dogs who do work or perform tasks only. And I'm not familiar if there's any difference with the Texas state law, but if there's a dog that performs some function, then obviously they'll be allowed into a Red Cross shelter. The only provision for that is that the service animal's owner is responsible for feeding and care, and we can usually provide them with some sort of resources or things like that when it comes to feeding and make sure they have a location where they can take the animal out. But basically that animal is welcome throughout the premises, any of the public location in that shelter. And sometimes we do expand the definition to include other animals because there is a broader range when it comes to things like comfort animals, where we're not required by the law, but if we have the ability to make that accommodation, then generally we leave that up either to the shelter manager or to the local operation. There are some shelters that are simply too complicated and we have to hold back and say, look, only the service animals, only the dogs are allowed at this time. So it kind of depends. Okay. So when it comes to a service animal, we can only ask two questions. Do you need this animal because of a disability, and what work or tasks have the animal been trained to perform? And we do allow the animals into the shelter regardless of any license or usually there's a little vest, but we can't always ask that because it could have been a disaster that caused the licensure documentation to be lost or something like that. So as long as they answer these two questions, then that's considered a service animal. Okay, so partner agency collaboration. So when we're looking at working with partners, there's a lot of opportunity and there's a lot of ways that we look at finding strategic partners that can help us find resources. So first example is with interpreters. American Sign Language interpreters are not the easiest to find, especially in a disaster. A lot of times there's a scheduling or things like that. So we're starting to work nationally with some vendors of video remote interpreting, that we can just literally have a tablet or an iPad and bring it to the shelter, and then we can bring somebody in remotely. And that's a fantastic technology that allows us to really make sure that all our shelters are going to have some sort of an ASL component to it. Medications are always a challenge in a shelter. So there's a lot of national relationships we try to bring in, and when it comes to finding medication. Same thing with hearing aids, glasses. A lot of people don't know that we can assist with replacement of these items, but we do. Anytime that there's a need or something that there's someone lost some sort of a durable medical equipment because of the disaster, we can assist with that. Okay? Restrictive or specific diets. This is becoming more and more of a challenge. There's a lot more sensitivity to different types of foods in our society, and particularly in a disaster, we look at having general meals for everybody, and that's no longer something that we can continue to do. So we need to find some of those vendors, and we're continuing to work to find different vendors for specialty diets, whether it's gluten-free or soft food diets, things like that. And anything we don't have the ability to find, we'll reach out to different medical facilities. There's a lot of facilities that have different types of diets that can be accommodated, and often there's a very small number of people in the shelters that have that particular need. Accessible cots is definitely one of the areas that we've started looking at nationally at increasing our stockpile of. An accessible cot is basically a little bit taller than a regular cot. It doesn't wobble as much. It has an elevated head and foot rest, and there's also a pad on it. And part of the reason for that is to assist with transfer from a wheelchair, to make sure that it's a taller cot, it's a little bit wider, a little bit more sturdy, but also it's a cot that's used potentially for people with different medical needs and things like that. So we try to call it either an accessible cot or a universal cot, basically saying that anyone can work on it. We also have a series of bariatric cots for people who are, have a higher weight need. Mobility devices. So different shelters will usually try to have some sort of minimal supply of wheelchairs, walkers, canes, things like that, to make sure that our clients that have lost it during a disaster have got some sort of temporary solution. We don't have a lot of those, and a lot of times when we're working with a client, we try to identify, well, what happened to their equipment? If it was lost, let's try to work with their insurance or the health care and try to figure out a more permanent solution if we can. And then support for activities of daily living. This is a great opportunity for partner agencies. When we need to bring in a personal attendant, someone has specific needs that is beyond the skills of our shelter staff, we want to make sure those needs are being met, even if it means that we need to find someone who's got a specific skill set, who's literally there at the shelter with the client, and if the client needs to go on to transitional housing, then the personal attendant will go with them. So a functional assessment of Red Cross shelters. So the assessments are something that we're starting to see more and more. We definitely did this in Hurricane Sandy, where it's a joint agency team that goes into each shelter, and typically this will be after a storm where we're starting to really kind of gather an understanding of what's happening in the field, and this really takes a series of specialists to go out to identify how accessible is this facility. Even if you have the survey, there's certain things that you might want to locate or just visually see what's happening in the shelter to make sure different accommodations are being made. And sometimes the Red Cross volunteers are not the specialists in doing that on their own, so we will bring in partner agencies who are specialized in that to be able to tell us, look, you really can make an additional accommodation and it's not going to be that challenging, but let's work with these clients. And that's definitely encouraged. We want that expertise, we want that support. So we have a Red Cross liaison appointed to the team, and we'll assess the general issues in the shelter. And we'll also look at the shelter intake forms. The shelter intake forms, when we're doing the registration, it started as a medical form, but it's been modified so that it actually pulls out different disabilities that people may have that might not be accommodated. A lot of times if those forms aren't all processed by the one nurse that's on site, we need to have an assessment team go through and start with those clients to say, look, we checked this box, someone has an additional need, let's go talk to this person, let's find out what their actual needs are going to be. We also encourage this assessment team to interview the shelter population. We'll have them meet with the shelter leadership, and if the issue involves a client, then that individual really needs to be a part of the conversation. Sometimes someone who checks the box gets into the shelter and tells us, look, I have everything I need. I'm perfectly independent, and these are the risks that might be occurring, but otherwise, I think I have everything under control. And that's what we want to support as much as possible. So we The one thing about this team that's come up in the past is commitments for use of Red Cross resources can only be made by the Red Cross leadership, but any suggestions that are made by these multi-agency teams are definitely looked at from our sheltering operation headquarters. All right, so I put my contact information up here for anybody who would like to reach out to us. Okay, so that's all I had for today. I don't know if there's any questions about that. I kind of talked a little quickly, but I hope that this was at least helpful. Are there any questions?
Is there a particular signage that we can put up that's...
Yeah, so the question is there particular signage in a shelter that can be put up? And is this, are you speaking in general terms? For people who are hearing impaired?
Yes.
Okay, so the answer is yes, and we do have a lot of signage. Now the question is, are you going to have different areas of the shelter where, you know, there's going to be a larger population?
And where tables are set up, and we just kind of have signage that points people to that area where they don't have to look around.
Okay, so it depends on the services that are provided. So is there signage, is there signage available for people who are looking for sign language interpreters? Okay, so if there is, for example, a video remote interpreting station, then absolutely a sign should be or could be a very large print available. Sometimes it could be a sign that says the sign language interpreter will be in the shelter from such and such a time. Now, there's not a lot of standard signs for that, but it's very easy to make a sign very quickly in a disaster, and yes, we can do that.
Do you have examples?
We can talk afterwards to try to come up with a communication strategy, because it could also be, you know, it's whatever the needs are going to be in the shelter. It could be that we need large print. It could be different messaging that needs to be posted in different languages. But yeah, we want to make sure that people are aware of the services that are available. But generally we'll know those who have needs for that service because we've captured it in that registration or the initial intake, and we'll be able to go up to those clients and let people know that this service is available and this is how they can access it.
This would be for evacuation site where people are like coming into the back of this gym and they're coming up to register to be able to bus to leave.
Okay, so I mean that's
Same type of service.
Sure, yeah, and a lot of times those services would be right there at the registration because that's the first time they need to communicate with someone. So we want to make sure that you know, if there's a communication need, that resource is there when they first come in. Well, it's going to be at the registration table. And if someone who's at the registration table says this person needs a sign language interpreter, then we'll have that interpreter go up to that table and assist the client directly. And if they're going to stay at that evacuation point for longer, you know, if there's a trouble getting, you know, to the bus or there's a backlog or something like that, then we'll want to make sure that interpreter stays there to be accessible to the client to communicate. So, but yeah, I mean, that's a specific thing, but generally it's that intake process. We want to make sure the communication is facilitated.
I'm concerned about people who are hard of hearing that do not know sign language. CART is available, and I am aware of it, but there are many people who have never seen it, don't even know what it is. They don't know to ask for it. Many of them won't even tell you they're hard of hearing. What can we do about that population?
So the question is for those who are hard of hearing but are not fluent in sign language, you know, or they don't even know it. Absolutely. So there are additional resources that we'll have in our shelter trailers that will help. Sometimes they're flip books and picture books to let people know, hey, if we're having trouble communicating, let's have some resource, some way of understanding each other. That's really what our goal is going to be. So once we understand what is a good method of communicating, then we'll make sure that that is what's provided. So it could be a flip book, it could be Braille, it could be writing, you know, different things. And so the solution is really going to be, you know, if someone is hard of hearing, they generally will have some method of communicating with their family or something like that, hopefully, and hopefully their family members can assist. And if not, then absolutely we'll reach out to our partner agencies to say we need some additional resources. We need someone who can specialize in this and tell us because we're having trouble communicating with this client. Does that answer your question? It's best as I have now, but perhaps we can talk afterwards. Oh, sure. Thank you.
Hi. One of the things that we're doing is we have kits and we have a lot of equipment, assisted listening devices, that we bring out. So as the Red Cross, as we find out at these different locations, we're more than happy to share that equipment with them. We've been doing that now for a little while, and I actually brought one of the kits with me if anybody's interested in looking at it. So.
Great. Great. Thank you. All right. Any other questions? Okay. Thanks, everyone.
Good morning. My name's Linda Landers. I am a Regional Disability Integration Specialist for FEMA. It's a long title. Basically what I do is I work with FEMA to ensure our programs and services are, have open access, equal access for all citizens, not just survivors, but for all citizens. These are new positions. These have only been around I've been in the position 3 years. I was one of the first people hired, so I work with, just a little background on what I do, I work with our FEMA programs, so as we're planning, doing disaster planning, working with our states and our local governments, as we're doing preparedness activities in the communities with individuals and with locals, and also working with community partners, disability partners in a lot of different areas. So I'm going to go a little bit today about some of the lessons learned. In the last year, I spent about 6 months on the road. A couple of months I was in Louisiana for Hurricane Isaac. I was also one of the first on the ground in New York for Sandy, and worked a little bit here in Texas recently with the fertilizer explosion at the plant, and just got back last week from 6 weeks in Oklahoma. So after the tornadoes. So a few lessons learned that I'd like to share today. I do want to go back, the question, and we were talking about the assisted listening devices. I didn't get onto the tape. One of the things that we have been doing is really looking at, and I work in Region 6 for FEMA, which is Texas, Oklahoma, Louisiana, Arkansas, and New Mexico. And we are very progressive in our region, so we have kits that we take to disaster sites, and we set them up in our disaster recovery centers for survivors to be able to access our services. So it includes, we're putting iPads in there so that we have video relay interpreting, we have assistive listening devices, we have magnifiers, a lot of different things, some of our materials in Braille and in large print. And we also work very, very closely with Red Cross and some of our other organizations. So as they have a need too, and they see that, we are able to provide those. We have a new program called Disaster Survivor Assistance Teams that go out door to door. They're also equipped with iPads with video interpreting, as well as the assistive listening devices. So those are always available to support. We're continuing to get more of them so we have them out in the field after a disaster. So we are very interested in making sure communication is available for everyone. Some of the things in the last few disasters are some of the misconceptions that we've been hearing from community members and others. One of the things that we heard in New York from a lot of people was, well, you know, they're going to come and get us because we have such a large fire department, emergency personnel. And I actually just got this, it's a Fire Department New York vital statistics. There are 8,175,133 people in New York. And when you, there's 10,000 uniformed personnel, this is just the fire department, EMS there's 3,400, and civilian 1,600. What it works out to is one emergency person for every 596 citizens. So if you think they are going to come and get you out of the high-rise building that doesn't have power, think again. There were people who were stuck, 175 buildings, high-rises, that a lot of people didn't evacuate. Power's out for 2 months. So, you know, some people they planned for 3 days, they didn't plan for 2 months. And so it was a huge issue of getting people out, getting food, getting medications, and everything up to people. We actually had the National Guard. We have young folks who are part of what's called FEMA Corps. They're part of the not citizen corps, it's one of the youth groups, but we have a lot of them. They were schlepping food and supplies and knocking on doors, checking on people in high rises, dropping off 3 days worth of supplies, carrying stuff up 30 flights to get to people. So if you think that somebody's going to come get you, plan as if they don't. And that's a message that I am really pushing out to community members, disability or not. Be prepared. One of the things we heard is because the year before the storm, Hurricane Irene went up the coast on the East Coast, but it hit north of New York. And a lot of people said, well, it wasn't bad last year. It won't happen to us this time. They didn't pay attention to what was on the weather report, what the weather channels were saying, and they just thought it would be the same. So they were caught in all of this. And the other thing is from an emergency management point where I say, everybody just needs to be prepared. They need to have a kit. They need to have a plan. For some people, that's not really possible. There are some barriers to that. People with disabilities typically have a lower income. They may also have some other barriers like Medicare and Medicaid may not give you additional medication to have a 3-day or a week's supply or a month's supply to have on hand. So we can say be prepared, but there's got to be some reality and some ways for us to help people to be prepared. But again, if people can't afford to go out and buy all of the stuff that they need for that kit, one of the great things here in the Houston area is you have a 18-month planning calendar that walks you through and says, if you can buy 2 extra bottles of water this time and maybe something else the next time, throughout the year, you build the kit. And that's an approach we really need to talk about, that people can break it down. They maybe can afford to do that. And how can we come up with ideas to help people do that? So some of the basics. One of the things that we heard, not only in New York, but even in Oklahoma with the recent tornadoes, is people don't understand what watches and warnings and alerts are. We assume that people do. Most everyone here probably knows the difference between a watch, a warning, and alert. People don't always know what that is. So we have an educational piece that we need to be doing across, and it's across the whole population. We're talking about the whole community, not just people with disabilities, but a lot of people don't understand the differences between these, and it's very important to know, because one's going to tell you something's right out your back door, and one's going to tell you have a little bit of time to get out of the way. So giving some more information and helping people understand what those are. Messaging, and we have a lot of conflicting information even after the tornadoes in Oklahoma City. A lot of the stations did have captioning. They didn't have sign language interpreters, but they had captioning on a lot of them. But if you're not watching the television, do people know what other resources might be there? What kind of apps they might be able to use? Are they watching the weather to say, hey, I'm going out, maybe I need to be careful? So one of the things I'm going to be doing is going back up to Oklahoma and doing some community preparedness activities with some of the groups up there to help them to understand what all these mean and how they can be safer the next time. The media's role in messaging. We hear this a lot about it is required of the media during a disaster or an event of any kind like that to make sure that they have captioning on the screen. Hopefully they're doing it at a speed that people can actually read it instead of having it zoom by. But they are required to do some things. Now, do they do it? Not always. But you can, if something happens, you can always make a complaint to the FCC. We had a case in Bastrop about 1.5 years ago with the fires, talking to a couple who said, we were watching the television, we had smelled smoke for days. We just assumed it was out there somewhere because they didn't have anything on there for us. They look out the back door, the fire's in the backyard, and they're running out the front door to get out of the way. So there was nothing on the television that told them, and it is vitally important that we encourage our media folks to understand how important, because it is life and death for some people if we don't have that on there. And then how to get the message out. We're looking at really creative ways of getting information out during disasters and after disasters. We do the traditional things where we look at, well, the newer things, the social media. We're all about social media, Twitter and Facebook. But one of the things I do is I build partnerships throughout the year with different community members. So when I see something coming, I can reach out to different areas, the deaf networks that are out there, send information, ask, can you push this out to people who are connected with you? Other areas, in looking at that, I'll start a phone tree calling out to people to make sure that we're getting information out in a lot of different ways, because we want people to know they may not have access to Twitter or Facebook. It may be inaccessible to them. We want to make sure we put it out in a lot of different ways so that people get that information they need. So one of the things that I really want to encourage too, and one of the things that we've been really doing in our region, is building relationships before something happens. The value of this is, I just can't even put the value of what this is. It is so huge. When I was in Louisiana, I already knew the people who were down there, so it was easy to partner and to be able to start looking at disaster response. New York was a little bit different. New York, there's a little bit of tension between the community and the emergency management community. So it was a challenge to get people to the table to start to talk. The time of a disaster is not the time to do that. So building the relationships ahead of time, it helps with understanding. So, and we're managing the expectations, because one of the things in New York, people thought everybody was going to come rescue them. They thought they had all these people who could come, and they had all these needs, and you've got 1 million people who are in the same situation. So how do you manage those expectations? How do you help the community members and the emergency managers sort out what's important, what's those priorities? So it's a way to sit down and talk about that and understand from both perspectives what's going on. It's also a force multiplier. One of the things that's incredible about in Louisiana, they have a group, and I'll talk a little bit about them in a minute. They have a group, and they're called the Emergency Management, Disability, and Aging Coalition. And they actually work together. There's about 120 members in this, and they've been trained in the EOC, and they've been trained on Web EOC, a tool that we use in emergency management. And now they, in their communities, can inform the emergency manager what's going on in their community. They will be able to get more real-time information in that. But also, when they're doing preparedness and planning, they're helping to look at how things are going and what the plans look like to make sure that they are all inclusive. Some of the promising practices we've been looking at, the fertilizer plant explosion in West. I'm sure most people have heard of that. I don't know if everybody understands the impact of that on the community. People, even if they were within 1 mile or 2 miles, the high school is about 2.5 miles away, structurally damaged. They can't use it anymore. There was an apartment complex right across the field from the plant. If you saw it, it was just devastated. There was nothing left but the frame of that, and people were actually in there when it happened. Nursing home across the street and a high school, or a school that luckily nobody was in. One of the things that happened is there was a fire, and people were outside watching the fire from 1 mile or so away, and when the explosion hit, it had the impact of, I believe it was a 2.5 earthquake. And the shrapnel from everything came at the people who were standing there. Many people lost their eyesight. Many people were either temporarily or permanently hearing loss from the explosion, in addition to losing everything that they had. So one of the things that we did is, when we saw that and we understood that the impact, FEMA usually comes in with the state, and we do financial assistance to help you rebuild your home. That's great. We're talking about major impact on lives in this one, and people who now have lost their eyesight, what do? So we brought in and partnered, and this is again back to the partnerships. The Department of Assistive and Rehabilitation Services and I have worked together now for a couple of years, and asked them to bring in their specialists to come to the Disaster Recovery Center in West, so that when you came and you got your disaster assistance, you could also talk to somebody. Now that you've lost your eyesight, you could talk to somebody who's going to help you in that part to get on with your life to be able to recover. So we wanted to look at the whole person as well as the whole community when we were looking at that. We also brought in the Area Agency on Aging, Heart of Texas, that provided benefits counseling, because if your injuries were significant, you're not going to go back to work for a while. We don't want to wait until you start losing your home because you can't work and you don't quite know what to do about it. Let's get you the help you need now. Tremendous success there. People were very, very happy with what they saw because they didn't know that these services were available to them. So when we talk about partnerships, it may be with some of our state and local agencies as well as our community organizations. In Oklahoma, it was a little bit different. We had community organizations like our Protection and Advocacy group was out in the shelters helping us look for missing family. Red Cross was looking in their shelters, but Protection and Advocacy was looking in the ones that were not Red Cross shelters, helping us to look for a family of 5 that the family members couldn't find. So we were looking at, there were a lot of different partners. The local sign language interpreter service, their individuals were out to the homes of people that they knew, providing services within hours to help them get information and get where they needed to be and where they could be safe. And then through the first week or so, helping to get people to the services so they could start rebuilding their homes. But we also had the Independent Living Center that was doing a lot of stuff with durable medical equipment. So we had some really great partnerships that supported Red Cross and our voluntary agencies, but on our very much on that disability part of those specialized things that people needed. Somebody donated 15 hospital beds. And I'm thinking 15 hospital beds, what are we going to do with these? But the Independent Living Center and another organization took those, but we actually had people who were hurt in the tornadoes that needed them, so we were able to get them to them. But it's all those partnerships that we had before the tornadoes that made it so much smoother afterwards. And then in Louisiana, the emergency MDAC, the Emergency Management Group, they've known each other for years since Katrina. They work together, they've developed plans, they've practiced together, they've now gone through the EOC training, the Web EOC, so they can now support the state emergency manager. This is the Red Cross, it's the Protection and Advocacy, Louisiana Technology Assistance Network. It's a wide range of people that now come together and when there's a disaster are going to be able to stand up and help their fellow citizens. So huge benefit to that, to all of these. There's been some really good experiences. We are looking very much at using the technology, and one of the things that I'm working on right now is putting together picture boards on the iPad. So for people who have a speech disability, we'll have that programs in there with things that are based on the disaster, hopefully, and working on things like that. Trying to be very innovative in what we're doing and using our resources. We are always at the invitation of the state. We always support the state, and we bring all kinds of things with us when we do that and help them. So, are there any questions? Cool.
My name is Lex Frieden. I've met some of you before. It's a pleasure to meet you again today. And this presentation is about emergency preparedness and response. And I have a little bit of experience with that. I was in the hotel across from the Pentagon on 9/11, and left the hotel to go to the subway, where I was going to go down to the rail station in DC and catch a train to New York, where I was about to fly to Lebanon. And I got dressed that morning. I was late waking up, and I dressed quickly, didn't turn on the television, left the hotel room, went to the elevators, and this is a really nice hotel there in Pentagon City. I backed my wheelchair onto the elevator, and these elevators had that polished aluminum coating on them. You could see yourself in the elevator. And I was surprised that morning that the elevator was packed. In fact, I had to wait through about 3 elevators load of people before I could get space to back onto the elevator. And when I backed on, everybody was real quiet. And I looked in the elevator and I saw myself and I realized that I had not combed my hair. And I thought, you know, these people need a little cheering up this morning. And I said, wow, it's been a rough day. And everybody moans. And I'm thinking my hair really, really does need combing. But I got down to the lobby and saw a crowd. I don't like crowds in hotel lobbies. I waved at the lady behind the desk and said, please check me out. She knew me, she would. And I went out the front door of the hotel. The subway stop, if you know that hotel in Pentagon City, is across the street from the hotel. That street leads to the Pentagon. It's about 4 blocks up the street from there. There were soldiers and military personnel and civilians marching up that street away from the Pentagon. I didn't look at the Pentagon. I saw the parade and I thought, wow, I didn't know this was some kind of a military parade day. But the people marching were polite enough to let me pass through between them, and I got to the subway stop. In front of the subway stop were 2 DC Metro police holding machine guns. It's not a common sight to see a Metro policeman, or any policeman in Texas or Washington, D.C. for that matter, holding a machine gun. And I said to the officer, sir, something's wrong. And he said, yes, turn around and look behind you. And the Pentagon was burning. So I decided, stay away from me in cases of disaster. In 2001, I was in my home, and the water started rising. And if you're in a wheelchair like this, you can go up and up and up and up and up. But what you don't think about is the water's covering the batteries, and pretty soon you stop going up, the water keeps rising, the batteries are dead, and you're stuck in a flood. And that experience was enlightening to me. Following that, in the time of Hurricane Ike, thank you, I was, you got to turn it a little bit. Thank you. Good. Volunteers take good directions. Thank you.
You're welcome.
During Hurricane Ike, I was without power for a couple of weeks. So during each one of these events, you learn a little something. The 9/11 event taught me you'd better be stocked with food. As soon as I got back to the hotel, I said, I need the key to my room. The lady said, I'm sorry, the military's already taken all the rooms in the hotel. And I remembered I had a key left in my coat pocket that I hadn't dropped in the box. I went upstairs, I got in the room, and I decided anybody's welcome to share the room with me, but I'm not leaving this bed. As soon as I stowed all my stuff back there, I went downstairs and there was one little eatery open, and I bought all the chips they had because I thought we might be in for a long haul here. And sure enough, it was 2 weeks before I could leave DC. After the floods, it was 2 weeks before I could get anybody to come and help me pull the wet bed and the wet carpeting out of the house. I did learn one thing at that time. If you call the published number for the Red Cross, the person on the other line will say, can I have your credit card, please? And it turns out that the most published number is the one where they take donations, not the one where they come and help you after a disaster. Fortunately, I was later able to get the right number. So always be prepared. Have the food you need, have the numbers you need, have your prescriptions ready. People with disabilities really need to learn this, and we need to help educate them. Now, I want to talk for a few minutes about the law and what the law requires emergency responders and shelter providers to do. You all know about the Stafford Act. Stafford Act tells us how to behave when emergencies occur, and that's the authorizing legislation for all the emergency planning that occurs. That was actually amended after the disaster in Katrina and Rita. Part of the reason the Stafford Act was updated was because 3,000 some odd people died in that event, and half of them happened to be people with disabilities or seniors. So we really weren't addressing the issues of people with disabilities the way we should. We didn't address anybody's issues, I guess, as well as the way we should, but particularly people with disabilities and seniors. You may recall one episode where several dozen people in a nursing home were killed in the disaster. Next slide. Americans with Disabilities Act also affects the way we're supposed to plan and behave in a disaster, as does the Fair Housing Act amendments of 1998. Next page. People who have access and functional needs have a right to receive those services. Next page. The ADA, the Fair Housing Act, and the civil rights requirements are not waived in disasters. You know, this is interesting. I've been told before by emergency personnel that people with disabilities can be basically carried any way they have to be carried. They don't have to have any kind of provisions for communication, assistive devices, or anything else, because it's all about the disaster. Now, in the moment, that may be true. When my home is burning and I need to be carried down the steps by a fireman, I'm not going to argue about how he or she is lifting me. But when I get to the bottom of the steps, I'm going to need my wheelchair. And I'm going to ask them to help me sit in my wheelchair in a manner that won't injure me further. So do know that the requirements for civil rights for people with disabilities and others are not waived simply because it's a disaster. Some shelter providers misperceive this as well, and hopefully we're doing the kind of training that's necessary to shape things up in our communities. Next page. The ADA requires emergency managers and shelter operators to make what's called reasonable modifications to policies, practices, and procedures when it's necessary to avoid discrimination. What do I mean by a reasonable modification? Many shelters have a, quote, no pets rule. Some people with disabilities have animals that assist them. Visually impaired people often use dog guides. Some wheelchair users have helper animals. Some hearing impaired or deaf people have helper animals. You must modify the no pets rule in order to accommodate and assure the equal rights of people with disabilities who have these animals. And trust me, the animals are well behaved, they're well trained, and if they're not, then maybe you have some reason to have a discussion with the person who's managing them and make some changes in the way they're being managed. But you must change the no pets rule if a person with a disability needs assistance. That's just one example of a reasonable modification. Next page. There is a misperception that people with disabilities need to have specialized facilities in which to survive. That is not true. I can survive in any space for a while, and I can survive quite a while if you have a bed I can get into and some food I can eat. And I can survive even longer if my assistant is with me to help me dress and undress and manage my personal hygiene. I think Sharon Knowles has told you what functional needs and support services are. FNSS we begin to talk too much in alphabet soup and don't talk enough about what we're talking about. But functional needs and support services are intended to help people with disabilities manage and to be as independent as possible. There's a concept in the disability movement called independent living. What is independent living? How can I live independently? I can't even tie my own shoes. How can I live in the community independently? I can't mow my own yard. How can I be independent? I can't drive a car. But I can make decisions that affect my life. I can ask someone to tie my shoes. I can ask someone to drive me. I can have my yard mowed just like other people in my neighborhood by somebody else. So independence is a kind of a baseline word that people with disabilities relate to. And we can be independent despite our functional needs. So if you're hearing impaired, you may need some kind of accommodation in order to know what's going on around you if everybody is speaking orally. If you are visually impaired, you may need somebody to help you see what the sign says. And if you're a wheelchair user, you may need a ramp to get up the steps. But given those accommodations, every one of us can be independent. And that's the objective here, to make sure that people with disabilities are independent in the light of disasters. And we can be independent in shelters just as well as we can be in our homes and our community. Next page. Side benefits of FNSS, I think, are evident. Women who are in the later stage of pregnancy and older people and people whose body mass requires special equipment may, by the way, not be, technically speaking, people with disabilities, but they have functional needs. Next page. We've heard a little bit from FEMA about the need for planning, and planning is important. If you know what people are going to need, then you can accommodate them before the fact. Too often, we wait until a disaster occurs, we set up a shelter, people come there, and then we try to figure out what they need. A much better practice is to consult with people now, assume they're going to come when the time comes, and be prepared for them when they arrive. Next page. The kinds of things we have to prepare for that we may not be accustomed to. You know, it used to be that we would set up these special needs shelters. It wasn't too long ago in Houston that we had some of the best special needs and medical shelters in the country. And people with disabilities never knew where those were going to be. They were taken there if they were deemed necessary, and the people were well cared for. All the needed supplies, equipment, assistance was provided. But you know, that's a segregated approach. It's not the most practical approach. People with disabilities are apt to live everywhere, and they will wish to go with their families to wherever their families shelter. In Louisiana, after Katrina, many people with disabilities were told they could not even go in a public, general, mass care shelter because they had special needs, and they were routed off to some special place. In some cases, they never arrived. People with disabilities must be accommodated in mass care shelters. The law says it, so let's get ready. Durable medical equipment, walkers and wheelchairs, they're not hard to stock. You can have a few, you can add more, you can find out where to get them when you need them, but know ahead of time. Consumable medical supplies. Personal assistance services are one that's harder. But stop and think about it. If you have 300 people in a mass care shelter, some of those people are probably going to be willing to spend 8 minutes to help me hold a microphone. Okay? Some of them are probably going to be willing to spend 5 minutes to help me pull my pants up in the morning. So don't make personal assistance services harder than it has to be. Next page. Plans have to be made for how medical support is utilized in these mass care general population shelters, and how to assess when individuals are not appropriate for these settings because of medical needs. And frankly, the only reason a person with a disability, almost any type of disability, the only reason they might need to be routed to any kind of a special segregated shelter is that they do have medical needs that require medical treatment. Most people with I haven't been in the hospital very often since I broke my neck 40 years ago. I am not a sick, ill person. People who are visually impaired are not sick unless they have a cold or the flu. People who are deaf are not sick. They're not medical cases unless they break their leg. The only reason people need to be in special care, medically oriented shelters is if they have medical needs. And if we want to define those people as being special because they happen to have a disability, we're making an error in judgment in doing so. Because I'm no more special than anybody else. I may have some functional needs, but you stop and think about it, you probably have some functional needs too. Next page. So best practices, go ahead and plan meetings. If you're a shelter operator, if you are a Red Cross, if you're a church, if you're a voluntary agency, if you have a shelter, if you intend to have a shelter, go ahead and begin to have meetings and have them with the whole community and make sure that people with disabilities are included. And it's not as easy as putting an announcement in the church bulletin, because people need to know they are welcome and wanted. So you may need to do some special outreach. Call the Center for Independent Living in your community. Talk to them and ask them to help you get people to come to your meeting. And if you're a church, they don't have to go to your church, but they'll know how the church people need to be treated too. And the same thing applies to any other shelter provider. Next page. Collaborative efforts are clearly the best, and everybody who's spoken to you today or who will speak to you will tell you that, and that's, it's more than just talk. If people are involved, then they feel like they're part of the solution and not part of the problem. Next page. Identify disability-related needs of the residents who are going to be in the shelter. We've said that, that's repetitious. Next page. Make the advance arrangements necessary to meet those needs in the event of a disaster. That's obvious. And the only problem is we don't always do that. Next page. What do we talk about in accessibility? Let me repeat what I said again. People with disabilities can manage appropriately, provided they are given appropriate supports. Next slide. How do we know if a shelter is accessible? There are 7 basic indicators of accessibility in the Fair Housing Act. They go from the parking lot to route of travel. How do people get from the parking lot to the space they're supposed to be meeting in or living in? We're talking about doorway widths. Can they pass in the route of travel? We're talking about, in the case of shelters, certainly bathrooms. Can they get into bathrooms? There was a survey of shelters done in Louisiana a couple of years ago, and while the shelters had brightened up their attitude towards people with disabilities, half of them didn't have bathroom doors that were wide enough for a person in a wheelchair to get through. So we have to look at things that some of us might consider to be obvious. It's important for people, if they're going to be in a shelter, to be able to get to where food is. And by the way, here's another reasonable a modification. Sometimes shelter operators have rules that say people are not allowed in the food preparation area. But let me tell you, there are some people with functional needs, disabilities, who need specially prepared diets. And they know how to make their food preparation, and they simply need a space that they can do that in. So you may need to alter the no residence in the kitchen rule to accommodate an individual who has certain special needs. And the law says you have to do it if it is a reasonable accommodation. That would seem to me to be an example. Recreational areas. You know, a lot of times in housing, apartment owners will build a nice apartment. They'll put a lot of amenities in it, and they'll make the pool up a rise on a platform or something. The people who pay rent to that apartment should be able to use the amenities that come with the payment of the rent. And yet, in those high-rise, fine luxury apartments, wheelchair users who pay rent are often not able to get up the platform to the pool. The same thing is true sometimes in shelters, where shelter providers think about providing an opportunity for shelter residents to exercise, to recreate, and the places are not accessible. So here again is an opportunity to meet the letter of the law and to provide appropriate accommodations for residents. Next page. Okay. Next one. Keep going. Keep going. Next one. So, pardon me if we went through those slides too fast for some of you to read, but you can get the slides after this is over. They'll also be online. I wanted to mention families. I mentioned in the case of Katrina, some people with disabilities were separated from their families. Some shelter providers have a lot of rules about who can and who can come into the shelter. Those rules need to be reviewed. People with disabilities need to have their families with them. They provide support to them, moral support, psychological support, sometimes physical support, sometimes communications assistance, and so on. And some shelters say children can't be over here in this particular wing, or we're going to separate men and women and so on. These are the kinds of rules that we really need to review in the light of the needs of people with disabilities, because sometimes we shouldn't separate them from their children or their family's children. Sometimes we shouldn't separate them according to gender. We need to do everything we can. And again, you know, some of you were here in post-Ike down at the George R. Brown. And my experience there was amazing. As a volunteer, I was there on several occasions, and the provisions that Houston made for those guests in that facility were, I would say, optimal and model at this point in time. There's very little one could say, even now, having the opportunity to look back, to be critical of the services and the provisions for people who were sheltered in that environment. So we do have best practices. We have models to look at, and we simply need to review our own individual practices. Next page. I mentioned the no pets rule. Next one. I mentioned the kitchens. I'm checking myself here. Next one. Here's one. A lot of times people come into a shelter and they're assigned a space. People with disabilities may have preferences regarding the space. In reality, I suppose everybody might have a preference regarding space. But I think it's important to prioritize and provide the opportunity for people with disabilities to help select their space. Someone with a hearing impairment may need to be in a space where there is less ambient noise. You would not know that. You would not understand that. They will be able to identify that space very easily and quickly. Somebody who uses a wheelchair who needs assistance with bodily functions might prefer to be against a wall or in a corner where they could use a curtain to have some degree of privacy. Don't arbitrarily put them in the middle of a room with cots all around them. Okay, next page. Effective communications. We heard some discussion before about communicating with people who are hearing impaired. There are sufficient numbers of sign language interpreters in Texas, many of them who volunteer in the case of disasters, many of whom have pending contracts to work for different agencies during disasters, to ensure that there are sign language volunteers anywhere there's a shelter that needs them. We need to have a system to assure that there are sign language volunteers in every shelter. And it's possible to do that. It's up to you to make it happen. Same thing applies to personal assistance. There are people who work for long-term care facilities, skilled nursing facilities, hospitals, and other facilities who know how to provide light-duty physical assistance. I didn't say medical care. I said light-duty physical assistance. In other words, if I need help rolling from one side to the other on my cot, those people can be very, very helpful to me. So we need to identify those people and make sure that we invite them, provide incentives for them to be present in our shelters. Next page. Alternate formats are always important. It's an easy rule. You know, if you write something down, you expect somebody to read it. Make sure there's a way that it is read without them having to look at it. We're from Houston. We're technology savvy. We can figure that out. Anybody here from Fort Bend County, Montgomery County, any place around here can figure that out. If you think people are going to read it, then also believe there are people who can't read it and you need to provide an alternate format, and vice versa. There was one episode down at the George R. Brown that I recall. At one point, some volunteer emergency manager from Tennessee, I think, could have been Kentucky, got a group of people together in the middle of the George R. Brown and started shouting instructions to them. If you need to use the telephone, go up a floor and down the hall. If you need, and providing a lot of directions. And the deaf people were just kind of standing there like, yeah, okay. Where did, you know, what in the world is he talking about? Is the place on fire? Tell me. So if you have to deliver an instruction orally, make sure you also deliver it in an alternate format, even having the assistance. And by the way, not every person who is deaf or hard of hearing is proficient at sign language. Some people who use sign language use private sign language, home sign language that they learn with their parents when they're children growing up. They don't know the kind of sign language that professional providers provide. So make sure there are alternatives to the alternative. And sometimes that involves a written substitution for an oral direction. Next page. We all know about TDDs. They're sort of out of service. Just make sure the cell phone service is working where the shelter is. Do anything you can to get that Wi-Fi back on, because that's the way so many people communicate today, and particularly people who are hearing impaired. And by the way, there's a misconception that people who are visually impaired don't use the iPhone, the Android, and so on. They do, because there are special hooks built into the operating systems that enable them to do so. Next page. When people move into a shelter, this really is good for everybody. I think it's a standard practice to provide some kind of orientation, let people know where the bathrooms are, the kitchen is, what time the food service will be, and so on. Sometimes visually impaired and particularly blind people need to be basically walked through the space with direction so that they can find their way back there again. And so just add one little link to the orientation service program. Next page. And what about people who are upset? What about the large portion of people with disabilities who are mentally impaired? What are we going to do to accommodate them? One thing we can do for them and for the rest of us who kind of get thrown off balance in the course of a disaster is to provide a quiet room. And I don't know how many shelters do that, but that quiet space and making sure it stays quiet is really, really important. That's an accommodation that I think should be routine. Next page. Electricity, sometimes we hide the electricity when it is available. You may have people in the shelter whose life depends on electricity, so let's get the generators out and let's try them out. We did a little survey before Ike, coincidentally, and we asked nursing homes along the route between Galveston and Houston, when's the last time they had their generator tested and on? Most of them couldn't even answer the question, much less having tried the generator since the last time it had to be used. So let's get generators up to par, make sure they're working. Next page. Finally, when the time comes for people to leave, please don't put up a sign, make an announcement that says the shelter will be closing at noon tomorrow. Many of the residents who have disabilities, and perhaps others, can't simply leave and go back home after they've been in a shelter. In some cases, their homes aren't there anymore. In some cases, they're not livable. In some cases, the people who provide assistance to them when they are in their home are still in shelters someplace else. So make sure that we plan a transition period, a time frame when people can begin to make arrangements to transition out of the shelter. And I can't tell you how important that transition process is. At this point in time, you can go to the next slide. If you have a need to call and talk some more, 800-949-4232. We answered 3,500 calls after Katrina and Rita and provided assistance to people with disabilities at that time, and probably nearly half of that many after Hurricane Ike. And we'll be glad to do training for you. We'll be glad to send a person to your facility to do a walkthrough with you, to consult with you about shelter needs for people with disabilities. And if you are a person with a disability, don't hesitate to call. We can tell you what the law says about your rights and how to file a complaint if you think they've been compromised. Thank you all very much for being here. I really appreciate it. I think we have 5 minutes for questions. The question was, are there any published rules or guidances that specify the minimal number of people with medical needs that have to be accommodated in a mass care shelter? Right, or which kinds of, supplies, right? Yeah. So no, the answer to that question is no. The best solution to the problem is the one I talked about, which involves prior consultation. If you can identify a priori, generally the population that's going to be in that shelter, or a sample of the population to find out what their needs are, then you can be best prepared. Now, I know, I have privy knowledge that there are, FEMA is working in the region to ensure that necessary supplies are stocked. CETRAC cooperates with the emergency management officials to make sure necessary supplies are stocked somewhere, and we bring things in and to be able to help the shelters. Sharon may want to talk more about this when she summarizes the program, but by and large, my answer is the people are part of the population, and unless they have real medical needs, they need to be accommodated in the facility. But go back to the slide that I gave you about people managing under certain circumstances. People can manage for a few days without special supplies. Many people will bring their extra supplies with them, and you probably need to accommodate that some way so they can put the things in a safe place. Most people with disabilities who come to our training are told, take what you need for at least 3 to 5 days with you. They won't have them in the shelter for perhaps 3 to 5 days. So if we're working at it from both ends, hopefully we can solve the problem. Any other questions? If not, again, please be in touch. Let us do anything we can to support you, and we are ever, ever, ever so grateful for the work you do supporting us in times of disaster. Thank you very much.
I want to take this opportunity to address any remaining questions. There was a question earlier that had to do with signage in an evacuation center for persons who are hard of hearing or who are deaf in order to direct them to the entry point of where they would begin the processing for getting evacuation assistance, right? Okay. I've done some checking during the break, and we don't have a specific set of answers for that. There are some general signs that some evacuation hubs locations have used. What I'm going to recommend is that I will take that back to the FNSS committee at the state level, which will be meeting later this month. And we will talk about that at that point as a part of the FNSS toolkit. So before I ask if there's any other questions, I also want to see by raising hands, how many people are aware of the FNSS toolkit, the Functional Needs and Support Services toolkit created by the state of Texas? Now all of you have, there's a whole lot of hands out there, and you're going to hate the next question. How many of you have actually read it? All of it. I mean, actually read every word in it. If you've read the version 4 and you have questions about some of the language isn't clear or something along that line, please email it to me. Please email it to me, because that's part of what we need to get clarified so that the language is not ambiguous, can't be interpreted a whole lot of different ways, and doesn't end up creating planning gaps. So for those who don't have my email address, it's Sharon, S-H-A-R-O-N, .Nalls, N-A-L-L-S as in Sam, at HoustonTX.gov. I will take that back to the committee. The other thing that we're looking for at the committee is best practices. If you have a best practice in your community, something that you know that's worked, it works well, and you're wanting to share that with others across the state of Texas, then please send us information about that. If you have a question that's related to how do I implement, or I have a problem in implementing something that's covered in the toolkit, please share that as well, because that means there's a deficit in the toolkit in addressing a particular issue. The whole purpose of that toolkit is to make it useful for every community. Make sense? Okay, so if we're going to continue to make progress for Texans and for people in our own region in regards to planning for whole community, it takes everybody's input. It's kind of that borrowing of the statement of it takes a village to raise a child. Well, the village suffers the disaster, and it takes the village to recover from it. So input up front will help us to move forward. So with that, I'll take any questions anyone has, and if I don't know the answer, I'll point to somebody who does, or I'll take that back to a committee. Yep. The question is, when is there going to be training dates for the coordination and the use of equipment? What equipment?
For registration.
For registration equipment at an evacuation hub or at a shelter?
An evacuation hub.
At an evacuation hub. You would need to, one, know which equipment that you have, and I would suggest talking to the folks from the State Department of TDM, the guy back there. Yeah, Jay can help you with that because I don't know what specific equipment you have. If you're in the immediate Houston region and you have issues regarding the evac equipment that's used and purchased with UASI funds in the Houston region, that would be John Nolan. Raise your hand, John. John Nolan is the guy who's most familiar with that equipment. That answer your question?
Yes, thank you.
Next question. Yes, ma'am.
Can you repeat your email address?
It's Sharon, SHARON, Knalls, NALLS, at HoustonTX.gov, G-O-V. Other questions? Going once. It's an auction. Going twice.
Thank you.
Okay. There not being any other questions, let me say this. By show of hands, did you find today to be helpful? Okay. That tells us that this set of seminars that we do is valuable. It's valuable to all of us, and we will continue to do them. So, that being the case, while you gave us a positive response with a show of hands that it's helpful, what we really, really need for you to do today is complete the survey form. It's extremely important because it helps guide us on where we go with the next seminar. What we have found is that the building block approach to this makes it much easier to address the process, and it becomes a two-way dialogue and a two-way learning experience for all of us. So please, please identify what you're looking for next, and give us these see, now I'm getting twisted. These survey results back. I want to thank the planning committee that would put this on. Those of you who were all involved, Tramika, Mel, if y'all can raise your hands. You guys did an excellent job. These seminars are not the easiest to put together when you've got a full plate with everything else to do. So hats off to both of you and those who helped you. Thank you again today.